Hello, my name is Dr. Peter Laniewski. I'm a specialist plastic surgeon. Today I'm going to talk to you about implant choice for breast augmentation surgery. Now, given you're thinking about breast augmentation, you might have already thought about or researched the different types of implants that are available on the Australian market. Now, I only use TGA approved implants, and I only use specific brands to achieve the desired look for each of my patients. The brand I've favoured most recently because of my research and because of the safety of the product is the Motiva implant. This is a nano-textured implant. Now, you may have struck this in your own research, and the reason I use this is quite important. The texturing is very small and nano-specific texturing, which means that the patient's body does not form a very aggressive shell. Now, this is thought to cause problems in other types of implants where they have what's called macro texturing. And the trend recently, and based on the scientific evidence, is to go away from these macro textured implants because of the potential for problems with capsule formation and a disease called ALCL. It is extremely rare, however. It is better to be safe when there is even a small amount of evidence that this may occur. So the other advantage is that the implant remains soft to touch and feels as much as a normal breast as is possible to achieve with implants. Now, the next question comes to choosing between the size and the shape of implants. The size is fairly easy to determine. That is based on your own chest wall dimensions, so there's no two ways about it. I measure your width and height, and from there we can work out what is the correct implant. The choice then is to work out how much projection and how full volume you would like with the implants. So that really is the key determining factor where we have a discussion about how you currently look and how you'd like to look with breast implants. So in terms of shapes though, there are different types of implants, and that comes down to the firmness of the gel. I tend to use round implants for most of my ladies, simply because the teardrop can be problematic. Because a round implant is round, it means that if it rotates, there's no effect. It still stays the same shape. Whereas with a teardrop implant, if that rotates, that can be problematic, and sometimes the only way to change it is with an operation.